Hi, my name is Lisa Cacari-Stone. I'm a principal investigator in collaboration with my two colleagues, Dr. Nina Wallerstein and Dr. Tassie Parker, weaving wide engagement for assessing vaccine equity in New Mexico. We're addressing the legacy of human rights violation and mistrust around research, as well as vaccines and government attention. We also want to highlight the voice and center the voice of communities that are least represented at the national level. We're addressing barriers and facilitators and community resiliencies and assets. We're also focusing on the need for data transparency, data sovereignty. Finally, we're building out a community of practice network to build co-learning across communities. I'm highlighting what we feel and see as our key contributions nationally. We have very broad partnerships. I want to emphasize our community of practice network of over 240 organizations and tribal affiliates. We have three major methods: surveys, where we will have analysis of 1,200 surveys statewide, catalyst films, which feature the perspectives of health providers, as well as digital stories, which focus on community voice in these particular communities. All of the data will be informed and co-analyzed by local partnerships in collaboration with Community of Practice Network. I want to emphasize the data sovereignty and data justice outcome in this particular presentation as unique. We seek to advance knowledge for increasing vaccine equity, for understanding the social ecology of why and how people get vaccines, but also how we can advance insights in terms of engaging in clinical trials and NIH-funded research. The major goal here is shifting political power, in which we focus and center community voices and balance that so that data justice is achieved. This is just one example of our cross-state analysis of the 30-plus stories from the digital story creators: Latino U.S.-Mexico border communities, urban African-American Black communities, Dene Navajo communities, and our urban Indian Native American shelterless communities. We have 7 major themes, and we have unique cultural themes that are very distinct to some of these communities. Complex grief and trauma have been the outcome of the vaccine global pandemic. Intergenerational ties have mitigated many of the structural risk and stressors due to COVID. Access to healthcare services, including Indian health services, local FQHCs, have been critical. Culture as resiliency has been a common theme across all communities. Our community practice network has been critical in identifying racial justice outcomes, including achieving policy change that helps build the infrastructure. Changes in institutional practices is what we seek, and also changing the narrative around trust and mistrust. I thank you for your time, and we look forward to sharing with the other CEAL sites.